So we have a patient with us today. The main concern that he was coming in with was shoulder pain on the left side, correct? And he's been under care for the last few weeks. He's going to elaborate a little bit about what it was that you first came in with. What were your symptoms like?
Yeah, my symptoms was really, I have a lot of pain in my left shoulder.
Yep.
And that pain also going all down to my hand.
Yeah.
And at the beginning it was only on the top.
Sure.
But it was keep coming down and down and down.
Yeah.
And it was very painful.
Yeah.
And it was very, very discomfortable.
Yeah.
I cannot reach anything.
Yeah.
If I tried to reach something, it was so painful.
Yeah.
So I was trying to hold my hand all the time. And everybody asked me, what's wrong with your hand?
Yeah.
I can't feel it immediately.
Yeah. Now, I was reviewing some of your health history just a little while ago. So this condition, although the most recent episode started maybe 2 months ago, or a little bit more than that.
About 3 months.
About 3 months. You've had the similar issue in the past as well, right? About a year and a half ago or so, or
Yeah,
more than
my
that.
right hand, yeah.
On the other side. So one of the things that we did was after the physical exam, what I noticed was obviously he had some restriction in his shoulder joint. So a lot of rotator cuff muscles that surround that area, they were not functioning properly. Some of them were deconditioned, others were just really, really tight and painful. And particularly abduction, which is the movement of bringing your arm away from the body, was very limited. To the point, I would say about 85 to 90%. So you could barely just get it out of your side,
Absolutely.
right?
Yeah.
But the kind of symptoms that he was getting, now you were getting pain down the arm, right? That went past the shoulder, right? And the history of the similar sort of symptom on the other side as well. So that triggered me to have a closer look at the neck, because the neck is so intimately related to your shoulder blade and the whole shoulder joint that you always need to look at the neck and the upper back area to see if there's any issues there, okay? So after having a look at his neck, the one thing that I noticed was the joints that were in the lower part of the neck, which is C4, C5, C6. So these joints right here, they send nerves that go down into the shoulder, arm, and hand. And these were the joints that were starting to get really, really irritated, and they were actually not moving the way that they're supposed to, okay? So there was an obvious injury to the shoulder, but the reason why the shoulder wasn't healing properly is because the nerves that control that healing, control the movement of the shoulder and the muscles, those nerves weren't functioning properly as well. Because we obviously took x-rays of the neck to see if that was an involvement. So what do you remember from the report?
I was remembering the report. When I see the report and the pictures, I was very surprised.
Yeah.
There was a lot of things that I didn't know.
Yeah.
And I learned the stage that, the damage from stage 1 to 2 to 3.
Right.
And sometimes it will go very serious if you didn't know in advance. I'm lucky that I know on the right time, which is you can fix it, as
exactly.
Told me. And also I learned the connection between the nerve system into your shoulder and to your hand.
Yeah.
I never knew that there's a connection.
Exactly.
It's like that.
After we did the physical exam, because I was suspecting involvement with the neck, we went ahead and we took some x-rays as well. So looking at the x-rays, there's clear damage between C4, C5, C6. This is where the nerves come out from that go down into the shoulder, arm, and hand. And so with the adjustments, my goal is to try to take some of that pressure off of those nerves, but also improve mobility in that area as well. The other thing was, when we had a look at his neck from the front, he had a shift in his upper part. So as you can see, it's quite a shift in the upper cervical segments. Come on back down. Take that contact right at C4, C5. Just going to do a gentle adjustment there. Come on up. How have things changed for you?
Really changed a lot. I'm very, very glad I came on the right time.
Yeah.
And I feel the pain is going away.
Yeah.
First of all.
Yeah.
And the other thing that really I'm feeling is, for example, my walking. totally changed now. I used to be tightness. I was like something's holding me back. Now I'm walking like a normal, very light. I feel it.
So your posture is better. You're noticing that when you're walking.
Yeah, it looks like I'm standing like straight forward now. Before looks like I was bending.
Bending forward.
Yeah, and I'm trying to hold the pain. And I can't sleep at night. Without pain.
Good.
I used to use a lot of tablets like Leaf or Tylenol, but
just
I'm not gonna use it.
How about the mobility in the shoulder?
Yeah,
exactly. You pull your arm out of your side. That's awesome.
Before I couldn't, remember if I couldn't do that. That much, And even I was afraid to do that because sometimes the pain is so painful.